Assalamu alaikum, friends. This is Nadir Shah in Chicago, and you are watching my channel, Knowledge for Quality of Life. Friends, last time we looked at it, overall incidences of diseases, non-communicable diseases, as compared to the vitamin D level. And we overall looked at it, general diseases, including various types of cancers, heart disease, and all that. So today we are going to focus mainly on the cancers. So what I'm going to do, I've organized these vlogs in a form that, it's easily understandable, because I'm not going to discuss too much in as far as the studies are concerned, but I'm going to include in the description below so that people who wants to look at it in detail, they can read up upon it. And I would strongly recommend to read, because the more informed you are, the better decisions you can make for yourself and your loved ones. So let me share my screen. So as I said that, today we are going to talk about the risk of cancers, various cancers, in comparison with the vitamin D level in our blood. So this first slide, which you are seeing, is a breast cancer risk by vitamin D level. The population size was 5,038, and these women are taken as, breast cancer risk versus, if you look at the horizontal axis, vitamin D level. Now, this data has been calibrated and adjusted for age, BMI, which is body mass index, smoking status, and calcium supplement intake. So if you look at the reference, is anything less than 20 nanograms per milliliter is taken as a reference as 1.0. Then the women who were in the range of 20 to 39, their cancer risk ratio came 0.55. 0.55 means they lowered from reference 45% cancer risk when they maintained their vitamin D serum level between 20 and 39 nanograms per milliliter. And in nanomoles per liter is 50 to 99 nanomoles per liter. Similarly, women who maintain their vitamin D serum level between 40 to 59, they have a risk ratio of 0.48, means they have lowered their cancer risk by 52%. And then finally, if they have maintained their vitamin D level greater than 60 or greater than 60 nanograms per milliliter, which is equivalent to 150 nanomoles per liter, they have lowered their cancer risk by 80%. So from the reference, if reference is 1 and their risk ratio came 0.2, so the drop is 80%. So think about it that, this study is showing that, it's so potent that, vitamin D serum level in our blood, that we can lower the probability or risk of breast cancer by this much amount. The next is vitamin D level over time with prostate cancer patients. Now, this study comprises of basically 52 males, and they were diagnosed with stage 1 cancer. They were not treated for anything other than 4,000 IU for over a year, vitamin D per day, 4,000 IU vitamin D per day. And if you look at the horizontal line, it varies from 0 to 12 months over a year study. And then in the y-axis, vitamin D serum level in nanograms per milliliter. There are two lines you see here. One is a dotted line and one is a bold line. Dotted line is for African American population and bold line is for Caucasian. So if you look at it, the starting point, of course, due to the skin color, pigmentation, darker skin pigmentation, they had a lower vitamin D status to begin with before they started the supplementation, including we are in the same boat as Asians and Hispanic populations because we have a little bit darker skin, so we don't absorb as much from the sunlight as the Caucasians, white people. So the lighter the skin, better your absorption rate, which we looked at in the previous vlogs. So if you look at that, over the year time, both were reaching the same level, even though they started almost half off, but with supplementation, African American population is reaching almost the same in the 60 range category as Caucasians. So what they noticed that 60% of this population study, which was comprised of 52 males, they have lowered their tumor growth. But their PSA value, prostate antigen, was still there, but it didn't eliminate it, but their cancer tumor growth slowed. Out of 52 male, 15 were actually, after a year, they were cancer-free. So there were no tumor growth found, actually. There were no cancer cells found. So this was very powerful study. And this was given the first time in this study that authorized that giving 4,000 IU per day to any individual. The next is cumulative survival curve for patients with colon cancer. So if you look at the y-axis, you don't have to worry about all these studies I have included in the description, so you can read up on it and take time to read and digest. So cumulative survival is from 1 to 0, and at horizontal axis is time since the diagnosis. So how was the survival of different folks having a colon cancer with different status of vitamin D level in their blood? So if you look at it, the bold line here, which is 18 nanograms per milliliter, they had this kind of a survival curve. Okay, and then another dotted line here, you see that there was a little bit this different survival curve. Then if you see that another dotted line between 24 to 33, they had this third level of survival curve. Then if you look at the fine dotted line, which is greater than 33 nanograms per milliliter, they had this survival curve. So the point is that in this study, the objective was to have the serum level of vitamin D in our blood in such a way that we are close to 1. If you assume that 1 being at the water line, and if we are floating on the we are swimming in the water, we want to keep our head above the water line, and we want to be as close as to 1.0 to have a better survival curve. So you see here that 97% more survived when they maintained their vitamin D level 33 nanograms per milliliter or more. It was greater than 33 nanograms per milliliter. Similarly, if you look at the lung cancer patients, similar study, almost same curve. These are Kaplan curves. So if you look at 1.0 and low is a 0.0, and if you look at these different curves, as I explained in the colon cancer previous chart, that the fine dotted line, which is vitamin D level greater than 33 nanograms per milliliter, they had this difference between 209% more survived over time. So this is another powerful study which was done on the lung cancer patients. Then next one is patients with lymphoma. So again, the same concept here. It's a Kaplan curve. And if you look at this fine dotted line, again, which is greater than 33 nanograms per milliliter, it means that they have, in these 4 categories, they have maintained a little bit more nanograms per milliliter as a vitamin D level, then the survival rate with the fine dotted line was 22% more survived. And next one is, this study was done for female 55 and over. The population size was 2,304. If you look at it, this is the y-axis is the adjusted hazard ratio for cancer, and then x-axis is vitamin D level from 0 to 100. So if you look at it, the lower the vitamin D, this green line, this green curve, the lower the vitamin D, you have an almost 9 hazard ratio of 9. But if you assume that 20 is an average reference, which is 1, because here 1 would be here, but if you look at if you read this y-axis as 3 here, which is cutting the 20 nanograms, and if you go further down the curve at 60, at 40 and 60, which we've been saying all this time in the previous vlogs, we've been discussing that this is the optimum by these 48 leading experts. So if you look at that curve becomes flatter and flatter, and between 3 at the 20 nanograms per milliliter, and at 40 becomes at 40 nanograms per milliliter, the adjusted hazard ratio becomes 1. So from 3, it drops to 1, which is 33% lower. It means that, if you subtract 33 from 100, it means that you have lowered the risk of combined all cancers in this study, 67% lower risk of cancer with vitamin D level 40 and onwards, as compared to less than 20 nanograms per milliliter. Now, if you look at what happens beyond 60 and above, that curve remains pretty much flat, close to 0 hazard ratio. It means that we have looked at it last vlog, the incidence of non-communicable diseases lowers dramatically beyond around 60 and beyond. So this curve validates that study as well, that results. Let me stop share here. And so what we have seen here, that the vitamin D level, as far as the context of non-communicable diseases, as far as cancers are concerned, doesn't matter what type of cancers we are talking about. It has a great anti-cancerous effect. And I have included one also study that it tells you that what biologically it does to the cell growth of cancerous cell, how it diminishes the cancer, or how it nullifies the cancer, or how it kills the cancer cells through different pathways. So I would strongly recommend to read that study as well. Now, remember that these are different mitigations with what we are talking about. Again, the vitamin D is not the silver bullet here. By no means I've been saying in all my vlogs, vitamin D is not a silver bullet, but it is the basic premise of protecting oneself, because the whole entire metabolic processes and entire over 2,000 genes, which we will look into the future vlogs, that how they are dominated by vitamin D level in our blood serum. So what I'm saying here is that whatever is in our power to mitigate those risks, we have to do it. And remember that, as I said in the previous vlog, that, nature has wired us for this vitamin D. Nature never wanted us to take the supplement, of course. Nature always wanted to take through the sunlight. But unfortunately, the type of lifestyle that we are leading, we are not getting enough. And some folks are saying that, generally vitamin D deficiency is whatever reported in the media or in scientific papers, it's overblown, but that's not true. I'll give you my example. We are a family of 5. And when I caught my own deficiency, I went with each and every one. So all 5 family members were tested. So out of 5 family members, 4 were deficient. So it means that 80% were deficient. Now, when I say deficient, means they were not, no one was above or within the optimum level between 40 and 60. The lowest range of my family member was 8, and the highest was 34.7. Now, you remember that 34.7 is just a little bit above the minimum lab range, because lab range, which we talked about in the earlier vlogs, is 30 to 60. So actually, my wife was 34.7, but she was not optimum. And I will tell you that what happened once we became optimum to our health, and what actually we saw in the form of results. And the papers tells us this, and we have validated within our family as a best practice, that what I have practiced, and that's what I'm sharing with the wider audience. By no means this is a recommendation. By no means this is an advice, but I would strongly recommend you to take this information which I'm sharing here and take it to the next level when you communicate with your doctor. And first of all, get yourself tested and see what is your base level. Hopefully, I will see you next time with another disease and its prevention and its correlation with vitamin D. See you.